We just wanted to show you some usage scenarios that worried us when we saw it, and this is a typical case of usage that we noticed when we were developing the annual reporting uh, reports, and this sort of usage started giving us wrong counts, uh, and due to which we began investigations and we noticed this sort of usage. Now, this scenario is not to point out to anybody. They may have been lapses even from our side in terms of training, or there was possibly too much to absorb at the point of implementation, where the concepts may not have been very clear. So this sort of usage is seen across hospitals, and therefore this intervention in terms of showing you all how uh, therapies need to be used correctly. Now, what's wrong with this particular scenario? There are three therapy compliance meters, and ideally, for a patient receiving MDT treatment, there should only be one compliance meter on the patient's record, tracking uh, the therapy from the point of starting it to the end. Uh, so there are two redundant ones. What seems to have happened here, and this is a pattern we've always seen, there's a cascading milestone, uh, ordered milestone across therapies. So the first time the patient came, two doses were given. This seems to have been done correctly. But the next time the patient came, on 22nd, two additional lines were created where pulse 14 and pulse 15 were given on 2022 2. Uh, in our minds, the corrective action is a little bit complex. It involves a lot of actions from the doctor's side. So we'll try and walk you through what needs to be done. So let's look at it. We first have to get rid of the therapies uh, that are redundant, and um, our thoughts are that you choose the therapy with the oldest milestone, because the planned end dates on that would probably reflect the right dates that the patient should be completing the treatment by. Uh, so click on edit compliance meters, and we want to keep this particular therapy active, and we want to cancel these two. So that's just simple enough. Just change the status on the therapy to cancel and save changes. Uh, as we notice that the patient has been given the 15th pulse. So what we'll have to do now is make sure that those are ordered on this particular therapy. If you notice that it's still saying in progress, that's because we haven't saved the treatment chart yet. So just to clarify this particular thing, what we'll do is we'll just write a note, because the system will expect a note here. So and then click save. Now let's just come back. And you can see that the status has been set to cancelled on the two therapies, and below there should only be one therapy line that says in progress. Now, since the patient has already taken pulse 14 and 15, and it's likely that you're opening this record when the patient has come back for pulse 16. So what we'll do now here is mark uh, issue pulses 14, 15 and 16. Okay. So the three lines come in here. Let's just choose government supply and click save. Now there's still a problem that we need to think about, and that is that the three orders that were placed now, two of which were, and the patient may have consumed those medicines. So we don't want the pharmacy to dispense all those medicines. So what we'll do is we'll cancel two of the requested orders, so that the pharmacy is only seeing the next pulse on their screen. And we'll also need to update the compliance meter to reflect whether the patient has had all the pulses. Uh, the date in the system is 10/4. This will not happen for the pulse that you just ordered, but because I'm using a database that's quite dated, you're seeing this particular scenario. So assume that 16 shows up in a non-editable state. Now let's just ask the patient whether they've completed the dose on time. 1912. Let's say they finished it on time. One. That was 13.3. So we'll mark those changes. And save it. Let's come back and take a look at whether everything is right. And you have the actual end dates recorded in the system, and dosage 16 will become active on the date once the system date has passed uh, the planned end date of that pulse. In this particular case, because the database is a bit dated, it shows up this particular anomaly. Uh, the other usage scenario that we've noticed is for doctors to totally bypass the package and therapy area and go straight down to medication and do this. And order the. But the problem will be that the tracking of the treatment will not be possible, because the system cannot track individual medications that are ordered in the medication panel. The system only tracks MDT compliance when it's done through the therapy compliance area. So we would recommend that this practice is avoided for MDT, that you don't go manually and request for pulses, but that you do that through the therapy compliance area.